spirit. She was born in Vineland and called Sparta in Sussex County her home for the past 35 years. She leaves behind her husband, John, president of the Essex County Latino Chamber of Commerce, along with her children and stepchildren and step-grandchildren. I know she will not be forgotten, and she was only, and this is my age, 62 years old. God bless you, Evelyn. Sam McGee, there is handsome Sam, was the first African-American elected to serve as mayor of Hillside in 1988. He was a member of the Township Committee and also served on the Union County Improvement Authority, among other posts. Adding to his years of public service was a career as a high school history teacher and 32 years as Dean of Admissions at New Jersey City University. We send our condolences and prayers to his family and friends. And there's also Dr. Francis Molinari of Kearney, who was a physician for 4 decades, tending to his own practice in Belleville, serving on the staff at Clara Mass Hospital, at the Meadowlands Sports Complex, as well as working for 30 years for Hudson County prior to his retirement 2 years ago. To his wife Lorraine, with whom I spoke yesterday, and daughter Andrea and their family, we join you in mourning his loss and praying for his soul. The conversations that I have had with our families who have lost loved ones to COVID-19 are not easy, nor is sitting here telling some of their stories easy for any of us. It's nothing compared to what they're going through, both the folks who have left us as well as their family and friends. And we have to remember them. We must recognize the tremendous toll this virus is having on our state, and seeing these faces and hearing these names reminds us that behind the stark and impersonal numbers are real people, real human beings, real families. And we all have a role to play in reducing the number of people we lose. We have to keep with social distancing. That is the key to cracking the code, flattening the curve, and getting us to a better place. And again, remember, when we flatten the curve of the number of people who are infected, we lower the amount of hospitalizations, the amount of intensive care hospitalizations, and ultimately fatalities. One thing does lead ultimately directly to the other. This weekend is Easter weekend, and I know is one where we are used to gathering together as we do normally at Passover. We gather normally at Easter to worship. We gather for children's Easter egg hunts, for family meals with friends. We can't do any of that this year. I feel awful, but we can't. We have to leave the gathering to FaceTime or Zoom or just simple phone calls and texts and emails to our family and friends. Instead of heading to church, many of us will fire up our laptops for a live-streamed service. Staying apart this year is the surest way we'll be able to gather again next Easter and the many Easters to come. So please take this to heart and take this seriously. We all must work together. And if we do, unequivocally, we will come through this stronger as one New Jersey family together. But we each have to do our part. And the 9 million of us need to flatten that curve. Stay home. Stay away from each other. Again, that leads to fewer infections, fewer hospitalizations, fewer intensive care unit hospitalizations, and fewer loved ones who we will lose. And we will, you and me and the rest of the 9 million of us will manage this front, while our extraordinary, heroic healthcare workers and our teams represented by Judy and Ed and Pat and others will build out our capacity of beds, ventilators, personal protective equipment, medicines, and certainly relief from the bullpen for our heroic healthcare workers. We win those two fronts together. Those lines have to cross at a reasonable level. And if we keep it up, if we stay with it on this weekend, this Easter weekend, and every day in the near term, near to intermediate term, we will win this together. Switching gears, we know this public health crisis has extended into our prisons. And Commissioner Hicks, and I want to give him a huge shout out, has been attacking it for weeks and will address his efforts in detail in a few minutes in his remarks. The pandemic has touched many of our corrections personnel, just as it has those who are incarcerated. A virus this virulent can spread rapidly in a densely populated prison setting, and the needs of public safety and public health have to be balanced. To that point, I just got off the phone a few minutes before coming here with the widow of Nelson Perdomo. His wife Fanny and I spoke. They're from Old Bridge. Nelson was only 44 years old, member of PBA 105. He leaves behind his wife Fanny, their 3 kids who are 18, 13, and 12. Awful, a guy who's left us far too soon. Mahan, even though I'm speaking about him today because I just connected with his blessed wife, maybe we can have a picture of him tomorrow, if we could, just to make sure everybody puts a name with a face. I also spoke with my fellow Middletown resident, Bill Sullivan, who was not only a president, not only a friend of Nelson's rather, but is the president of PBA 105. To Nelson, his memory, his wife Fanny, their 3 kids, to Bill and all their colleagues, our thoughts and prayers and hearts go out to you. So in that respect, today I am signing an executive order to help preserve this balance between health on the one hand and public health and public safety on the other. Under this order, certain low-risk individuals whose current age or health status puts them at particular risk for COVID-19, who had been perhaps denied parole within the last year, or whose sentences are to expire within the next 3 months, may be placed, and I say maybe, on temporary home confinement or granted parole if already eligible through an expedited process. And I want to stress that no one convicted of a serious crime, such as murder, sexual assault, among others, will be eligible for consideration. We are setting up a robust process through which each potentially eligible individual must be determined to be safe to place on home confinement, and each will be required to have an individualized release plan to ensure they will have access to all necessary services, medical services, and housing. No one who cannot meet these standards will be released. Individuals on home confinement will be subject to Department of Corrections supervision. As I noted, we have dual or twin responsibilities here, protecting those who work in our prisons and those who are incarcerated. Social distancing is extremely hard to accomplish in a prison setting, and allowing some of our most vulnerable individuals who do not pose a public safety threat to temporarily leave prison will protect both their health and the health and safety of the men and women working in our correctional facilities. And by the way, we're not the first to do this. New Jersey will join several other states. Some of the big ones are California and Illinois, and the federal government, by the way, which have taken similar steps. And again, I want to give a big shout out to Marcus and his team, who have been mightily trying to stay out ahead of this challenge. Again, when you've got concentrated communities from day one. And this is a big, important step to help to allow them to continue to stay out ahead. I also want to acknowledge the Director of the Department of Homeland Security and Preparedness, Jared Maples, Deputy Counsel Paramel Garg is in the House with us as well. Quickly, onto the subject of testing, a reminder that tomorrow, April 11, Bergen Community College drive-through testing site will be open to the public, and the PNC Bank Arts Center will be open to healthcare workers and first responders only. Both sites will open at 8 a.m. and will be able to conduct 500 tests apiece. Again, to receive a test, you must be symptomatic. And both sites will be closed on Easter Sunday. There are 18 other sites around the state that are publicly available, and you can find a map with all of them by going to covid19.nj.gov/testing. And there are dozens more privately operating testing sites that your primary care practitioner can direct you to for a test if you meet the requirements for testing. When you add up all the sites, I believe, as we said yesterday, it's at least 57 different sites. To receive a test, you must be exhibiting signs of respiratory illness, and you could take our self-assessment as one of your first steps. Again, on the master website, simply go to covid19.nj.gov/testing. It's anonymous, and by the way, not only does it give you some sense of where you may be, but it gives us the information that we need to help identify potential coronavirus hotspots before they flare up. That knowledge is critical for ensuring our healthcare networks have the supplies they will need before they are needed. Speaking of supplies, I want to give a huge thank you out to Uniqlo. You may know Uniqlo is an extraordinary retailer headquartered in Japan, by the way, to give another piece of evidence that we are scouring the globe for help here. Uniqlo yesterday delivered a donation of 100,000 much-needed medical-grade masks for our frontline public health and safety responders. This is the essence of what it means to be a good corporate citizen, and we are incredibly appreciative. Thank you, Uniqlo. And by the way, if you have any PPE to donate, no matter how much, please let us know by going to covid19.nj.gov/PPE donations. While we're at it, I also want to give a big shout out to the Stevens Institute of Technology and my friend President Nariman Farvarden for opening their Jonas Hall dormitory so the folks at Hoboken University Medical Center and the Hoboken Fire Department can have a place to rest and recharge. So thank you to everyone at Stevens for thinking about their Hoboken neighbors. I said we would be brief today, including in the Q&A, so forgive me, because it is Good Friday. But because it is Good Friday, I want to be able to share one more story of some of the good being done around our state. So on this most solemn of Fridays, here's something hopefully that will lift your hearts. Today I want to recognize the members of the Wyckoff Girl Scout Troop 24 in Bergen County. There's a couple of their members, right? There's a member rather on the left, and there's a healthcare worker on the right. After reading stories of nurses describing the physical discomfort caused by the straps of their face masks, the troop took to producing simple headbands that can be worn under the straps to reduce their discomfort and make life on the job just a little bit better. The troop donated their headbands to the Valley Hospital in Ridgewood, and there's an example of the headband you can see on the right of that picture. So this is how we are going to get through this. It is both the huge donations of 100,000 masks, and for that we're incredibly grateful. But it's also the little thoughts, like headbands, to make those masks less uncomfortable to the professionals who are wearing them day in and day out for hours upon hours. So Uniqlo, we thank you. And to the members of Wyckoff Girl Scout Troop 24, we thank you. New Jersey thanks you. And I ask each of you to keep tweeting out the stories of your heroes, and by using the hashtag #NJThanksYou. Everyone who is pitching in to help us through this deserves our thanks. So too does everyone out there who's doing the right thing to help us flatten the curve, especially with a major holiday weekend upon us. This cannot be a weekend to think we can let our foot off the gas. We're not even close, folks. We have to keep with it. Today, tomorrow, Sunday, and every day until this war is won. And win it, we will. And again, you're starting to see some glimmers of hope. Look at the amount of people discharged yesterday. Look at that county map. Look at the beginnings of the flattening of that curve of positive tests. And remember, as we've said before, with the heaviest of hearts, even though those metrics are beginning to look a little bit more positive, we will still lose many folks in this state, sadly. Because the folks we're announcing, Judy and Ed, today, who have lost their lives, may have been infected several weeks ago. So we're now seeing the sad end to some of the realities that hit us weeks before us. But stay with it. We will win this unequivocally if each and every one of us does our part. And we will, from the little things like washing hands with soap and water to bigger things. Stay home, please, period. Social distancing, no matter where you are, including at home. All the way up to the steps that we're taking today, including, for instance, the executive order that I'm signing today as it relates to our corrections facilities. All of these are pieces in a broader puzzle, and as we each continue to drop our pieces of the puzzle in place, eventually that will be a beautiful tapestry of our one New Jersey family, finally back on its feet, together again, stronger than ever before. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good morning. I want to take a moment to thank Commissioner Hicks and all the support he's given the Department of Health in working to protect the safety not only of his employees but of the total forensic population. And all of our sister agencies, this is really a whole of government approach, and they are all vital to the effort, and I thank them not only for their support but for what they're doing every day. I want to share some information on our veteran homes. As you know, New Jersey has 3 veteran homes, and they continue to be impacted as well. Today, the total census in the veterans' homes in New Jersey is 845. The home in Menlo Park has 16 residents and 5 staff members who have been confirmed as positive COVID-19. And in Menlo Park, there have been 4 deaths of residents directly related to COVID-19. And right now, 12 of their residents from that facility are hospitalized. The Paramus home has 29 residents and 17 staff who have tested positive. There have been 13 deaths among those residents that is related to COVID-19. And currently, 8 of their residents are hospitalized. The Vineland location has no confirmed cases among their residents or staff. And once more, as a reminder, there's 845 residents, veterans in these homes. The Department of Health has been working with the veteran homes, and through our volunteer portal, we've been able to support their staffing requirements and have sent 15 registered nurses and 7 licensed practical nurses to support care in these homes. Additionally, 35 combat medics have been sent to Menlo Park, and 40 have been sent to the Paramus location. As the governor mentioned, according to data reported from our hospitals, there are 7,570 hospitalizations, which include the COVID-19 positive individuals and persons under investigation. 1,679 are considered critical care, and 1,663 are currently on ventilators. And today we are reporting 3,627 new cases for a total of 54,588 cases in the state. To date, we have tested 611,000 individuals. 46,676 have returned positive for a percent positivity rate of 44.2%. And sadly, we're reporting 233 deaths for a total of 1,932 deaths in the state. Of the total deaths, 58% are male, 42% are female. The age range is holding at about 1% under 30 years of age, 4% between the ages of 30 and 49, 17% between the ages of 50 and 64, and 33%, or 641 individuals, between the ages of 65 and 79, and 45% between the ages of over 80 years of age, or 866. 64% are identified as white, 20% black or African American, 6% Asian, and less than 1% Native Hawaiian or other Pacific Islander. 48% at this point have reported documented underlying conditions: diabetes mellitus, cardiovascular disease, cancer being some of the highest reported underlying diseases. Along with the governor, I want to thank all of you who are staying home. I know it's especially tough during the religious holidays when you would normally be congregating for religious services and family gatherings. I understand that while this may be disappointing to many who look forward to spending time visiting with relatives and friends, once again, it is imperative to continue to stay home to help slow the spread of COVID-19. So stay home, stay safe, and stay healthy.